Thymoma and thymic carcinoma are rare cancers that originate in the thymus, a small gland located in the chest, behind the breastbone, and in front of the lungs. These tumors are part of a group of cancers known as thymic epithelial tumors. In this comprehensive guide, we will explore thymoma and thymic carcinoma, including their staging systems, prognosis, treatment options, ongoing research, unique challenges, FDA-approved medications, risk factors, and available support resources. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Thymoma and thymic carcinoma. An overview. Thymoma. Thymoma is a slow-growing tumor that typically starts in the thymic epithelial cells. It is considered a rare cancer and accounts for the majority of thymic tumors. Thymomas are often found incidentally on imaging studies and are commonly associated with autoimmune conditions such as myasthenia gravis. Thymic carcinoma. Thymic carcinoma is a more aggressive cancer that also originates in the thymic epithelial cells but tends to grow and spread more rapidly than thymoma. Thymic carcinoma is less common than thymoma, but is associated with a poorer prognosis. Staging system for thymoma and thymic carcinoma. The Masaoka-Koga staging system is commonly used to stage thymoma and thymic carcinoma. It considers factors such as tumor size, invasiveness, and involvement of nearby structures. The stages are as follows. Stage 1. The tumor is completely encapsulated within the thymus. Stage 2. The tumor has invaded nearby fatty tissue or the lining of the lungs. Stage 3. The tumor has invaded nearby organs or structures such as the pericardium, the sac around the heart, great vessels, or the pleura, the lining of the lungs. Stage 4A. The tumor has invaded into neighboring organs, such as the heart, large blood vessels, or the trachea. Stage 4B. The tumor has spread to distant organs, such as the bones, liver, or lymph nodes outside the chest. Prognosis for early stage versus late stage thymoma and thymic carcinoma. The prognosis for thymoma and thymic carcinoma varies significantly based on the stage at diagnosis, with earlier stages generally having a more favorable prognosis. Early stage thymoma and thymic carcinoma, stages 1 and 2, early stage thymoma and thymic carcinoma are associated with a better prognosis. Surgical removal of the tumor, often with complete resection, is the primary treatment. The 5-year survival rate for early-stage thymoma and thymic carcinoma can range from 70% to 95%, depending on the stage and other factors. Late-stage thymoma and thymic carcinoma, stages 3 and 4. Late-stage thymoma and thymic carcinoma, which involve invasion of nearby structures or distant metastasis, have a less favorable prognosis. The 5-year survival rate for late-stage thymoma and thymic carcinoma is generally lower, ranging from 30% to 60%. Treatment for late-stage disease often involves surgery, chemotherapy, and radiation therapy. Promising therapeutics for thymoma and thymic carcinoma research into new therapeutic approaches for thymoma and thymic carcinoma is ongoing. Clinical trials and studies are exploring targeted therapies, immunotherapies, and combination treatments to improve outcomes for patients with these rare cancers. While there are no specific FDA-approved medications exclusively for thymoma and thymic carcinoma, treatments often involve a combination of surgery, chemotherapy, and radiation therapy tailored to the individual patient's needs. Why thymoma and thymic carcinoma are tricky cancers. Thymoma and thymic carcinoma are considered tricky cancers for several reasons. Rare nature. These cancers are rare, making them less well understood and studied compared to more common cancers. Varied presentation. Thymomas and thymic carcinomas can present with a wide range of symptoms, making diagnosis challenging. Association with autoimmune conditions. Thymomas are often associated with autoimmune conditions like myasthenia gravis, which adds complexity to their management. Aggressiveness of thymic carcinoma. Thymic carcinoma tends to be more aggressive and harder to treat than thymoma. FDA-approved medications for thymoma and thymic carcinoma. There are no FDA-approved medications specifically for thymoma and thymic carcinoma. Treatment strategies typically involve surgery, chemotherapy, and radiation therapy. Chemotherapeutic agents like cisplatin, etoposide, and ifosfamide are commonly used in the treatment of these cancers. Risk factors for developing thymoma and thymic carcinoma. The exact cause of thymoma and thymic carcinoma is not well understood, and there are no established risk factors. However, thymomas are more commonly associated with certain autoimmune conditions such as myasthenia gravis. Organizations and resources for thymoma and thymic carcinoma treatment. For individuals and families facing thymoma and thymic carcinoma, several organizations and resources offer support, information, and assistance. The Myasthenia Gravis Foundation of America, MGFA. MGFA provides resources and support for individuals with myasthenia gravis, a condition often associated with thymoma. The Cholangiocarcinoma Foundation. This organization offers information and support for individuals with thymic carcinoma. Cure Thymoma. Cure Thymoma is a patient advocacy group that provides information and resources for those affected by thymoma and thymic carcinoma. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.